This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
And welcome back to episode 3. Let's continue with Kurt giving us some very real, practical, clinical insight about artificial intelligence and insulin pumps and the critical thinking concerned with all of that.
So I think for us in sort of that clinical setting where you're dealing with real life sort of environments, integrating the AI there is great sort of hope to it that it will help bring along better outcomes, better care, ease of care planning, but as it generates more and more information to make better decision making, it also generates from my end more opportunities for manipulating parameters. And when I say that, it's that as we have this AI and all these inputs, for me, all of a sudden you have sort of the people around the patient trying to influence care, because they now have an opportunity to have this real-time data. This information is flowing to them minute by minute. In our case, it's really every 5 minutes, that they can chime in with their own comments, information, recommendations. And as we look at it trying to simplify and create better care, the nurse gets stuck in this situation where it's a little bit of an information overload plus outside pressures that start to affect your ability to make decisions about care. And so that tends to be, that's a new problem. Like, we haven't seen it. Again, this technology is very new in this world, and the parents are embracing it, and it's great. We want them to embrace it. We want parental involvement. We want family involvement. But it really does give them an opportunity to be hyper involved because there's so much information, because there's so much more control over it, that they get involved in it, and it becomes a little bit problematic for us. So that's sort of where we are right now, sort of on the implementing all the AI. We're not even implementing it. I feel like AI is implementing us. We're more responding to it and trying to understand it better. And so that's where we are right now.
Well, I just had a question for Kirk. It reminds me of the early days of the self-driving cars, where you'd hear all of a sudden the car would stop in the middle of the road and do strange things. But now it's getting more sophisticated, where people are really liking those self-driving cars. So do you think that that's where we are with some of this technology, like you're describing, that after we're fine-tune it and it's gonna work for us, or what do you think?
I do. I think your analogy is correct. I think that right now we didn't know we were sort of fighting the AI. We didn't know what the AI was doing, and we were managing the patient as we always did, with the information that we're given, and we respond to that information without knowing what's going on in the background. I know that as we started to really look deeper and understand what the AI was doing, all of a sudden we were managing better. Now, we were micromanaging, so we're spending more time managing, but I can say that those blood sugar values and those ranges were much better. So we got to that better point for blood sugars, but we were spending more time than we should have, because it was being sort of micromanaged, microdosed. We were going out, instead of giving a big bolus, they were numerous little boluses that obviously would keep that range more narrow. So I think we're going in that direction. And I think for the nurses, how do we educate the nurses so that they know what their job is interacting with the AI? Because we don't know what we're really supposed to do other than follow it. And then that sort of falls apart when the critical thinking kicks in and you're like, this doesn't make sense. And like I said before, like we may not be feeding the AI the information it's supposed to have because we never had to do it before. But I think it's going in that direction. I mean, I think the idea that that we could have an insulin pump that really manages the patient on a regular basis with less intervention from healthcare workers and nurses, that's great. And I think that's definitely where it's going. But right now, it's like I said, it's a little, like you said, the black box. It's a little bit of a black box. You know, information's coming out, information's going in, and can't see anything else.
Do you have any experience to share regarding how this might work in, say, a school environment?
Well, you know, a school environment's actually a good place for this to work because
Okay.
there are minimal interruptions. They're sitting, they're moving, they're walking. They don't encounter these significant changes that would cause spikes or drops in blood sugar. So I think it works really well in the more controlled environment, which makes sense because the algorithm is going to work better with fewer sort of variations. It's when you take them out and say in a camp where they're running around from activity to activity and they're different every day or at different times, it got a little wonky. We would see kind of big changes when you didn't expect it. So the more varied, or it's really a matter of like physical intensity or physical activity, the more varied it becomes, the harder we had, the more difficult it became managing the AI and the blood sugar. But a school setting is a great place. I mean, wouldn't have to do anything really.
So, as far as parents being open to this kind of technology, it sounded like you were saying earlier that parents are quite receptive or maybe too trusting of the technology.
I think it's two separate questions. I think
Okay.
they're very accepting of it. That anything that's going to help them manage their
Mm-hmm.
child's blood sugars better. I think the question about trust is a really interesting one.
Okay.
And I've talked to other nurses about that. That how do you give up that sense of sort of control that I'm taking care of my kid to AI that says now I can do it?
Hmm.
I don't really know where we fall in that right now. It's still sort of early and new, but it's something we talk about. That how do you? Because some parents buy into it right away, they love it and they're ready to do it. But it does require at some point accepting the fact that you're going to trust the AI to do this sort of the heavy lifting. Um, and some parents have, and some parents haven't. They're nervous. A lot of parents will call you every time they see a change in their blood sugar because it's real-time data. I mean,
Hmm.
it's a 5-minute delay, which is important when you get into that sort of critical situation. But they're getting that information quick, and they're calling you up, and they see something. So it's a mixed bag right now. But yeah,
Okay. So,
but they're accepting it.
a couple more questions, and then I have a question for Dr. McBride about the education component. So, do you think the technology has led to a decreased amount of nursing management?
Right now, it's my feeling. Again, we're talking about very small data sets.
Okay.
But it's increased. Like when we do
Okay.
this micro sort of managing thing, I'm looking at those blood sugars because we're monitoring them remotely. I'm looking at their blood sugars all day long.
Okay.
And honestly, I was an early adopter with this, that I could track them real time all day long, so I could get involved in early intervention if it was needed. And initially, when I was doing it, the other nurses looked at me like, "Why do you want to be so involved?" They wanted to do it more old school. That lunchtime you come in and get checked, morning you get checked when you first come in, kind of things like that. Where with the AI, there was again so much more control over it that you really could see these trends earlier, that you could head off an issue before it became one, because you could see the trend, the real-time data, but it resulted in much more time being spent on tracking, intervention, and things of that nature, where you're calling them in to do a blood sugar check more than you would, or you're running out to give them two Starburst or Skittles or whatever the parent wanted, to be the rescue carb.
Okay, and along that note, that was the other question. And these things change over time. The more we learn, the more the technology improves, things can change. But what have you seen in terms of risk involved or emergency interventions needed?
I think the risk is higher,
Okay.
but again, I think it's because we're not working with the AI together. Sometimes it's in opposition because we see something going on, but the AI has already taken action on it. So then we take action on it. So it's like twice as much action on that. And all of a sudden you're in a tough hypoglycemic situation. And so, so there were, I think, more concerns early on, but again, as we sort of learned to work with it, that became less and less of an issue. And then it turned away from the emergency situation to how much more narrow can we make this range? Don't go above 110, don't go below 90. And these ranges got tighter and tighter as we got better at it. But again, it ended up with more individualized care to do that. So I think we're in the right direction, but it's definitely a learning process. For me, it doesn't feel like I'm on the same team. I want to be on the same team, and as AI is progressing, I want to know about how it's progressing and how I should be interacting with it.
What's interesting is it sounds like nurses monitoring this are a component of the machine learning. In other words, you're training it to do the right thing at the right time, given the parameters that you're seeing. And, there's been some interesting scenarios with that around big companies who are going into healthcare systems, and they're generating lots of this type of capability. And part of the challenge is, who owns the technology? Is it the vendor who has the AI or the machine learning, or is it the data that feeds the algorithm that makes it smarter and smarter and smarter? And I just heard Kurt adding another element, because nurses and their decisions are training it. And, that's interesting. Some of these things have been used for things like selecting the right oncology protocol for patients, given the genomics, the epigenetics, and all, what's the right pharmaceutical protocol or treatment protocol. And in that case, the oncologist was the one that was training the algorithms with the data, all of the data they had, and the oncology expertise. And so it was a partnership in the development of product. So in this scenario, we've got nurses training the algorithms, which is really, really interesting.
This is very fascinating and very practical information. Thank you all so much. I wanted to, based on something Kirk said, I wanted to ask you, Dr. McBride, so have you noticed anything in the research, or have you seen anything recently about the need for education for, I was going to ask you about nurses, but, even patients, parents, etc., for how to know about the AI. I mean, we can offer a technology, but it seems very apparent that we need to know how to interact with it.
Well, it is almost part of that civil rights in terms of patients' right to know what's behind a technology that they're, and how does it really work. But it is up to the nurses often to educate. One of our major roles is to educate patients on things like this very thing that Kurt described. And so we often prepare families to go home with these devices and make sure that they can care for their children or their loved ones. And so it does get down to preparing, you back it all the way up to how do we prepare nurses to meet these roles that we are being called upon. And so with our new AAC and Essentials, we see a large focus on technology. And you can see why. A fundamental essential of nursing now is technology. It's become a major actor in what we do. And so we have to take into consideration, how are we going to build knowledge and competencies in nurses in the current practice setting for those that are currently practicing and beginning to onboard with new technology, but also how do we prepare young nurses so that they can be receptive to this day and age in technology and what's coming in the future, because it's only going to get bigger and more complex.
Well, before we go, I wanted to give the opportunity for you to share with us how you've been a principal investigator for electronic health record research and optimization. So if you just want to tell us a little bit how you've been involved in trying to optimize our electronic health records.
Well, from a number of avenues, my colleague, Dr. Mary Teets, and myself, a number of years ago, we had been called in by educators to say, how do we even begin to think about informatics in nursing education? And this was well over a decade ago, almost pushing 2 decades. And so we actually came at it from a conceptual model standpoint, because we were very applied at that point. We were in the practice setting as practicing doctorally prepared nursing informaticists. So what we saw in the field is there were essentially 3 important domains that nurses need to know about. There are those technologies like Kirk was describing that is point of care technology. It's at the bedside, whether it be electronic health record or a pump or device or whatever. And then from all of that, we have data and information that comes out of it that we need to be able to analyze effectively and use it to improve patient safety, quality, and population health, which is the 3rd domain. And so if we can educate nurses with all of that in mind, point of care technology, data management and analytics, and patient safety and quality, and add to that the fact that it is all in a complex environment within healthcare that is very policy driven. So we need to prepare professional nurses with all of that in mind. And likewise, it drives the research that we do because then you back up and say, how do we know they're competent? How do we measure and evaluate competencies with things like the electronic health record?
For sure.
And so that is part of our research, is actually to develop an instrument for evaluating whether or not nurses are practicing with domains of best practice. We also have done some work around clinical workflow redesign from a very applied standpoint, particularly advanced nurses that are at advanced practice and doctoral level. We begin to look at how do we redesign clinical workflows so that we optimize technology and it works with us rather than against us. And so you can hear Kirk as an advanced practice master's prepared nurse speaking to how he is trying to optimize the technology within his clinical workflow to work so that it is safe and effective. You also heard in his speaking that he used data management and analytics to figure out how this point of care device wasn't working for him. So I think it's really a great example of, and I'll add to that the fact that FDA is going to make sure these devices are safe for us with these algorithms. So it adds to that whole policy environment piece. So really great example that he shared.
Kirk, anything you'd like to add?
Well, I think that there's, obviously, this is where it's going to go. There's no stopping AI. It's here. It's going to grow. I think my biggest concern is that from the sort of the medical device side of it, how willing are they going to be to share sort of insights to their algorithms? Because the algorithms are their intellectual property. They're not going to share it. That is their,
good point.
That's their, that's theirs. And so when I think about the nurses trying to understand what they need to do to make it better or to make it useful, will those companies give that information to us? I mean, it's one thing to educate the families on how to use it. It's another thing to educate the healthcare providers who need to have much more of an intimate understanding of what's going on.
I saw you shaking your head, Dr. McBride.
Yes.
All right. Well, I wish we could just keep talking more, but we have reached the end of the podcast. So I liked how you two explained some of these complex terms and topics with regard to artificial intelligence and machine learning and so on and so forth, technology overall. You brought it very close to home. This was a nice conversation. You made it easy to grasp the info and how it practically applies to nursing and healthcare today. Thank you for taking the time out of your busy schedules. I would like to thank Dr. Susan McBride and Kirk Ornstein for joining us today. This is Maria Morales with Colibri Healthcare.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.